I would say building our workforce. We're actually working on training our workforce, understanding what they need to be able to respond to the kinds of things that we see in the world today, whether it's a communicable disease, whether it is being able to address chronic issues like tobacco use or heart disease, whether it's about our environment. We need people who understand how those work and being able to do that work. And so we're actually working on building and training and recruiting for a public health workforce that will take us into the future.
You know, we look at our workforce in public health today, and we see a real need for a mix of skills. Our traditional skills, I almost said old, not old.
Not old.
Our experience, our staff who have experience in some of the core foundational things that we do in public health, but also a need for us to bring in folks who work in urban planning and a connection with people who work in social services and work with data, and really bringing in those new areas and putting those together with our existing workforce to really do the work that public health has in front of it moving into the future. Even before the pandemic, we knew that our workforce within public health, we had a large number of individuals who were within 5 and 8 years of retirement just naturally. So then you add in the pandemic, the stress and a lot of things that happened during the pandemic. And we saw even higher numbers of individuals leaving out of our existing system. And without a strong pipeline coming in, that's where we're at now with the staffing crisis that we have in public health.
We're trying to work on foundational public health services. And in order to see if we're doing that well or what we need to be able to evaluate that or assess where are we today. And so in Ohio, we have a tool that we use with our local health departments where they can tell us where they are today, where they think their gaps are, and then we can actually now measure what it will cost to fill those gaps. And that's very helpful, because if you're being asked what do you need in public health, we all know we need to improve public health, but it's more important to also know what it is exactly. Do we need more effort in communicable disease or environmental health? And then how much, what do we need to get there? And we have a tool now that we are collecting data from our local health departments every year, asking those questions and getting those answers and being able to be better about where we're putting our resources and how we need to gather them.